Today we're going to be talking about the best way to taper any antidepressant, and this is going to work for any simple type of tapers. Hi, I'm Dr. Josef Witt-Doerring. I'm a psychiatrist and I've been working exclusively with drug tapers for the last 4 years. And over that time, I've really perfected a way to taper people safely off antidepressants. And today, that's what we're going to be going through. You know, the first thing I want to say is that the reason a video like this exists is because a lot of doctors are tapering people too quickly. If this sounds familiar to you, then you're definitely not alone, because what I hear from my patients a lot of the time is they were tapered off medications they'd been on for 5 years, 10 years, 15 years in a matter of a couple weeks, sometimes a couple months. It was way too fast and they went into pretty bad withdrawal symptoms. And a lot of the times they gave up on their taper, or they started thinking, maybe this was my underlying illness, when deep down inside they knew it wasn't. And the real problem with that is, the doctors were tapering them way too quickly. So this video is going to go through how to get it done right the first time through in the safest and most efficient way. So let's jump into the first thing you want to do. If you've just been doing some drops and you're going into withdrawal and you're not comfortable and you find yourself here, the first thing you want to do is stabilize. Go back up to the last dose where you weren't having any symptoms and just hold it there, because that's the place where we want to taper from, a place of stability. The next step is to determine how quickly you want to taper your antidepressant. For people who have been on antidepressants, I'm going to say longer than 6 months or so, we want to do a slow taper. And so this is going to be 5 to 10% reductions per month. However, if you've only been on an antidepressant for less than 6 months, I would say you could probably go a little bit faster. You could initiate that taper at about 20% per month, and you would slow it down if you started to have withdrawal symptoms. The reason we can do a slightly faster taper for people who have been on the drug for less than 6 months is because there has been less adaptations in the brain to accommodate that drug. Typically, these people will be able to tolerate larger reductions. But again, these two rates, the 20% per month versus the 5 to 10% per month, these are just starting points. And once we begin the taper, we listen to our bodies and we adjust and slow down if needed. So before I move on to step 3, I just want to quickly say that a lot of doctors really don't know how to do this kind of stuff. So please consider liking and sharing this content. Let's get the word out there about how to do these safe tapers so people can just get it done the first time correctly. The next thing that you want to know is how you're going to taper your antidepressant. And by that I mean, what vehicle are you going to use? Because these medications can be tapered in a lot of different ways. You could do compounded capsules, you could do it with tablets, and you could also do it with liquids. In general, we're going to try and move towards liquids if possible. And if we can't move to liquids, we're going to move to instant release tablets. And I'm going to show you how to look this up on GoodRx. Okay, so when you're tapering an antidepressant, you want to look for 2 different formulations usually. You want the instant release tablet, or you want to have a liquid form. All of this is going to be relevant to the United States where I work, but if you're watching from anywhere in the world, the best steps would be to just call a pharmacist and ask them on the phone, whether there's an instant release tablet or a liquid. And you could do this in the US if you don't want to do it yourself as well. So the first thing that we're going to do is before we go to GoodRx, we're going to look at Orange Book. This is the list of all of the approved drugs in the US market. And let's say, for instance, that we're taking Effexor, right? You're taking like 300 milligrams of like the extended release Effexor. You would put the generic name in. So let's do Venlafax. Let's see what comes up. You're going to unclick this thing that says discontinued. And then if you look, you see there's all of this like extended release tablet stuff here. See, none of this is good. Let's go until we see the non-extended release stuff. So this is page 1, page 2. So this is what we want to see. See all this stuff here that just says tablet? That's great. So that at least means you can swap over to a normal tablet form of this. And the last thing I'm going to do is I'm going to keep on going across to see if there's any liquid. So no. Okay. All right. So with venlafaxine, if you're on extended release formulations, this means that you could go from something like taking 300 milligrams once a day to taking 150 milligrams of instant release twice a day. Then you can go over here and you can kind of search on GoodRx and you should be able to see what the price is for paying out of pocket. So let's see.
And GoodRx is great if you want to use the coupons here if you don't have health insurance. Okay, so here we have generic Effexor. As you can see, for 30 of the 75 milligram tabs, it's like $2 at Walgreens. And it actually even gets cheaper the higher the dose typically. So if you're getting the hundreds, it's probably not going to be that much more expensive. Yeah, a little bit more. Okay. So next, I want to go through another example, which would be like, let's say we wanted to do escitalopram, so Lexapro. I'll show you what this would look like. So Lexapro doesn't come in some extended release capsule, but what I do know about it is that it comes in a liquid, and I'd show you how you'd figure that out. So you'd do, okay, unclick discontinued. And then as you can see here, we have these 6 options for solutions, and these are all made by these are all made by different pharmaceutical companies. You can see the ratio, this 5 milligrams to 5 ml. And then now that you know you want to use a liquid and that we have it in the US, you could come over here to GoodRx and you can actually see what the price is. So when you go here, you can see, so 10 milligrams of Lexapro is going to be anywhere from like $11 to about $45, depending on whether you're getting it like Costco's or Walgreens. You can change the form to this solution. And then you could see, okay, so how much for 300 milligrams of this? And it comes in the different sizes of the bottle that they're dispensed. So if I was doing 300 milligrams, I can update it, and you can sort of see how much this is going to cost. So anywhere from about $45 all the way up to $152, depending on where you're going to fill it. And that's how you use these 2 different tools, the Orange Book database from the FDA, and also GoodRx to, first with Orange Books to find out all of the different ways they make the drug, whether it's extended release capsules, instant release tablets, or liquids. All of that's going to be an Orange Book. And then you can come to GoodRx and you can search for like the costs of these things.
Now, there's going to be a couple of antidepressants which you're going to notice are not going to be available in liquids or instant release tablets. We'll be making some separate videos about tapering drugs like Cymbalta later on, and how to do that, where they use specific bead counting measures. But for most of them, you should be able to find either an instant release tablet form or a manufactured liquid. If you don't have a manufactured liquid, a lot of these drugs can actually be compounded into a liquid. Okay, so if you've now noticed that your drug comes in a tablet and it also comes in a liquid, I'm going to show you the different ways you would do them. All right, so we're going to go over 3 different ways to taper the antidepressants, kind of going from, I guess, the most inexact to the most precise, but also the cheapest is to use a scale. This is a Gemini scale, and so if you wanted to do like start with, say, a 5% reduction, this is how you would go about it. So you'd kind of get your little container on there, and then hit your tar button. Then you would weigh your tablet. Okay, so that's 0.128 grams. And if I wanted to do a 5% reduction from this, I would times that by 0.95. Okay, 1.22, because it doesn't go any lower. So I want to get somewhere around 1.22. So this is, I'm going to give you a heads up because you're going to see it when I do this. This is not really exact. Okay, so I'm just going to go 0.122 because that's what I'm aiming for. But it is good enough, and a lot of people have been able to taper in this way. So what you do is you get a razor and you just start by kind of slicing away. And so I probably went a little heavy with that first cut. So let's see what we got. Okay, so let's see. Okay, all right. Okay, so now it's gone up a little bit. And this thing kind of bounces around some. And so you can kind of take a little piece off.
And if you talk to anyone who uses this Gemini scale, you have to be okay with some lack of precision. And so I'm going to be okay with that. And so if you were sitting down in like at the start of your week and you just wanted to get them all done, and you were doing this maybe for the next 14 days, you would just sit here and you'd do this with all of your pills. You could pop them, you could kind of pop them in a little capsule, or you could put them in a pill box. You just take all the fragments, and then you would just kind of organize it in that way. And so essentially you have, one dose kind of here, and that's a 5% reduction. So what you just saw was a cut and hold style reduction doing dry cuts with a tablet. The next, I guess, maybe more sophisticated way would be to do a liquid cut and hold. And so because we are using Lexapro here, 5 milligrams to 5 mLs, if you wanted to figure out how much 5% reduction of that would be, it's the same kind of math. So 10 milligrams times 0.95. So, 100% take away 5%. And so we would be going to 9.5. And then, as you could see here on this syringe, it goes all the way up to 10. And because, like I said before, we're doing a 1-to-1 solution, and I would always recommend you do a 1-to-1 solution if you can, because it just makes the math so easy. Because now we have 10 milliliters, we know this is 10 milligrams. And if you wanted to keep things really simple, this is how you'd do it. So you're going to notice that actually between the 9 and the 10, and actually between any of the whole numbers, we have 5 spaces. And so what that means is each of these little lines is equal to 2. So 0.2 milliliters or 0.2 grams. And so if we wanted to go down by half a milligram, we would just kind of bring this forward until we're halfway between essentially right between the two of them, these two little lines, and that would be 5, and essentially that would be your dose. And then you would do that for 14 days or 30 days, and then after that you would just lower it down again. And this would be a very simple kind of cut and hold style reduction. As you progressed and you wanted to slow things down, say you're right at the end of your taper, you could go even slower. You could go down to just lowering it by one little space each time, and then you'd be lowering it by 0.2 milliliters. And yeah, so it's a really easy way to kind of slow the rate down by just decreasing the amount of spaces that you're doing every 14 to 30 days for a cut and hold. There is a way that you could do a slightly more sophisticated taper, which is called a microtaper, which is really common, and that is by doing, essentially, instead of dropping the dose every 30 days, you would drop it every single day, very gradually. I actually will show you this now because I'm going to use some equipment which you should buy. So the first one you may need to get is called an adapter cap. You can just get these from Amazon. And the reason you'd get an adapter cap is a lot of these bottles, they don't come with any easy way to get the syringe into. So at the start, you can just kind of pull it out like that, but eventually you need to be able to kind of pull in this way. So what we're going to be doing first is we're going to do the math for the liquid microtaper. So as we did last time, because it's a 1-to-1 solution and we're going to be taking away 5%, that means half a milligram for a 10, because we're starting at 10 milligrams. So now we're going to do, so we have a half a milligram. And so what would a half a milligram be if we wanted to divide it into 30 days? So we're doing a drop every day. We would be doing, I guess, 0.016. But that's not going to be an easy thing to microtaper because we don't have that level of precision. I would actually say, let's round up and go to 0.02. And so that's what we would aim for. And let's just do some math just to see if we lowered by 0.02 milliliters or 0.2
0.02 milligrams, if we lowered by that amount in 30 days, where would we be? So we'd be at a 6% cut. And so 6%, that's pretty darn good. It makes it way easier to do it with the syringe. And so I'm just going to go with 6% because it's going to be easier to do that level of precision. Here's what I would do, because we're going to be doing such small reductions, the level of that precision, to do 0.02, it's just simply not possible with this syringe. And so we're going to need to use one of the smaller syringes. And so we have a 0.5 milliliter syringe here, and I'll show you how we would do this. I'm going to pull to 9.6 milliliters, and I'll show you what that looks like. I'm going to pull past it, and then I'm going to just kind of get the bubbles out. Okay, so this is a 10 milliliter syringe pulled to 9.6. So we're missing out on the bottom 2 spaces before 10 milliliters, and that's exactly what we want. So I'm going to take this out. I'm going to cap it. And this is where we're going to start to do the real precision work. So here's my 0.5 milliliter syringe, and I'm going to put this one in here, and then I'm going to pull to 0.4. Okay. So as you can see, we left out 2 of the white spaces here, and we pulled to 9.6. And so I'm getting the remaining 10 milliliters in this little one. That's the 0.4. And because we have a 0.5 milliliter syringe, you can see the level of precision actually allows us to lower it down by 0.02, because between each of these, these larger decreases, so we have like 0.4 and 0.5, we have 10 spaces between there. So that will allow us to lower it down now by 2 spaces, and 2 of those spaces would be 0.02. And so for the first reduction, I would just push this up 2 white spaces, and that's my first day. And then the next day, when I draw it out, I would push it further by 2. And then the next day, I would push it further by 2, and the next day by 2, and so on and so forth. Eventually, I'm going to finish this one, and that would mean I'm at 9.6. And then you would you would pull this one less, and then you would go down. I'm only going to pull the big one to 9.2, and then you would keep on using this as you went down to really do those precise reductions. And so that's how you would do a liquid microtaper. And that is really probably the most precise way you could do about this. I know it seems kind of complicated, but once you get into the swing of it, it's really as simple as brushing your teeth, and it's super fast. You just whack your big syringe in, you pull up as much as you can, and then you get your precise one, and then you use that one to make those tiny daily reductions. So once you've figured out the way that you're going to taper, you need to start tracking your symptoms. This will help you know when you're tapering too quickly and when you need to slow things down. On the other side, it can actually let you know whether you could speed things up. I recommend tracking 4 things in all of the diaries I give to my patients. You want the date, you want the dose you took on that date, and you want your level of functioning and your symptom severity. A level of functioning and symptom severity, I just rate them on a scale of 0 to 10, with 10 always being the most disabled for both of those, or the most severe. And you just want to kind of track them. And so if you're at a 5 of level of severity, and you just, your symptom severity just kind of sits there, and that's your baseline. Maybe you've got protracted withdrawal injury. If you didn't have that, maybe your baseline would be around a 1 or 2 on the severity scale. But you just want to make sure that you're staying at your baseline. If things kind of slowly ramp up over time, you want to slow down the rate of your taper, wait for those symptoms to go away, and then resume your taper at a slower pace. Okay, so there you have it. That's the process that I would use to taper pretty much most antidepressants, but this is going to work with a lot of other psychiatric medications as well. Sometimes this is all you're going to need to taper, but if things are getting more complicated, we do a very comprehensive course. We're going to have a link to it in the description below, and you can check it out if you're interested.